Ovarian cancer is the seventh most common cancer of women in the world. It is the fifth most common cause of cancer deaths in women, and it is estimated that 1 in 75 women will develop ovarian cancer during their lifetime. More than 70% are diagnosed in an advanced stage. The symptoms of ovarian cancer are abdominal bloating, early satiety, which means a feeling of fullness after taking little food, abdominal and back and pelvic pain, loss of appetite, weight loss, bowel disturbances, bladder disturbances, and vaginal bleeding. Increasing age, a strong family history due to the presence of BRCA1 and 2 genes, which is seen in 5 to 10% of ovarian cancers. Endometriosis are some of the common risk factors of this disease. Pregnancy and breastfeeding reduce the risk. There is no optimal screening method for ovarian cancer as of now. A common blood test called ca125 is often used as a screening tool. ca125 is increased in 70% of ovarian cancers, but can be normal in 30% of patients who have ovarian cancer. Also, ca125 can be increased in normal conditions like menstruation, pregnancy, endometriosis, and it can be increased in non-ovarian cancers like stomach cancer, colorectal cancers, etc. So ca125 is not a screening method, but most patients of ovarian cancer may present with raised ca125. Very high levels are seen and can be indicative but are not diagnostic of ovarian cancer. It will definitely raise the suspicion of ovarian cancer. Women who carry the BRCA1-2 gene are advised to meet their physician and genetic counselor. They would need frequent monitoring, imaging, and also maybe surgery to reduce the risk of ovarian cancer. A biopsy or surgery is essential to make a diagnosis. Biopsy is a needle test which is done from the tissues where the disease has spread, which could include the omentum. Then imaging is done like ultrasound abdomen or a CT scan or an MRI to see where all the disease has spread. Ovarian cancer can present with ascites, that is water in the abdomen. This water is sometimes sent for testing, which is called ascitic fluid, to look for cancer cells, which also can lead to the diagnosis. And an elevated ca125 supports the diagnosis. Staging of ovarian cancer, stage 1 to stage 4. Stage 1 is disease is limited to the ovaries. In stage 2, the disease is in the pelvis. Stage 3, disease spreads beyond the pelvis. This is the most common stage in which ovarian cancer is identified. And in stage 4, it spreads to distant organs like liver, lung, etc. Chemotherapy and surgery are the two mainstays of ovarian cancer treatment. Usually, patients present in an advanced disease, that is stage 3. In such cases, chemotherapy may be given first, and then once the disease shrinks and the patient's condition improves, the patient is taken up for surgery. Chemotherapy is given usually for 6 cycles, which is around 4.5 months, either before or after surgery. And then the other treatment options could include targeted therapy like bevacizumab and PARP inhibitors like olaparib and rucaparib in BRCA positive patients. Once the disease recurs, surgery is usually not done. Most patients would receive chemotherapy and either targeted therapy or PARP inhibitors. Surgery at the time of relapse is usually done for those patients who relapse after a longer period, who are in very good health, who can tolerate surgery, and who have limited amount of disease. Once the treatment is completed, the patient is kept on follow-up. Usually for the first 2 years, the patients come every 3 months. For 2 to 5 years, they come every 6 months, and after 5 years, it's a yearly follow-up. During follow-up, ca125 and ultrasound abdomen are usually advised by the doctor. Additional scans and tests may be necessary if your doctor suspects a recurrence. The survivals for ovarian cancer depend on the stage. Early stage disease have more than 90% survival, whereas if it presents in an advanced stage, the 5-year survival is around 30%. Patients carrying the BRCA12 gene, immediate first-degree family members are advised testing in blood, which is called germline testing, and if they are positive, they have to take genetic counseling and precautions to prevent occurrence of breast and ovarian cancer. Ovarian cancer is a very common cancer seen in women. The symptoms are very vague, like abdominal pain, bloating, early satiety. If you have any of these symptoms or have a family history of ovarian cancer, see your oncologist immediately so that you're diagnosed early and have high chance of cure.